Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. VA copays for healthcare. Were you aware of them? There are some out there. There are different priority groups according to the VA, and you will fit into a specific priority group. The priority groups have different bells and whistles and what have you. And I wanted to read through this for you for urgent care and outpatient care, that type of stuff, just to bring you into the loop of how the VA works. So with that, hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. All right, let's jump into it. The current VA healthcare copay rates, that this is going to be for 2024. It was effective January 1st of 2024. It says here, there's a notation right out the gate. Some veterans don't have to pay copays. They're exempt due to their disability rating, income level, or special eligibility factors. All right, so moving on here, there was a new policy announcement, blah, blah. All right, let's go. Urgent care copay rates. All right, so there's no limit to how many times you can use urgent care to be eligible for urgent care benefits, including through our network of approved community providers. Both of these must be true. You must be enrolled in the VA healthcare system, and you must have received care from us within the past 24 months. That's 2 years. If you're only getting a flu shot at your visit, you won't have to pay any copays, no matter your priority group. Remember, I talked about the priority groups, and the VA fits you into those different priority groups. So 2024 urgent care copay rates, priority groups 1 through 5, copay amount for the first 3 visits in each calendar year is $0. Copay amount for each additional visit in the same year is $30. Priority group 6, and by the way, there's 8 priority groups. Priority group 6, if related to a condition that's covered by a special authority, $0 copay. If not related to a condition covered by a special authority, $30 each visit. Priority group 7 through 8, $30 copay. There is a notation here. Special authorities include conditions related to combat service and exposures like Agent Orange, active duty at Camp Lejeune, ionizing radiation, Project Shipboard hazards and defense, Southwest Asia conditions, as well as military sexual trauma and presumptions applicable to certain veterans with psychosis and other mental illness. Moving on here, outpatient care copay rates. If you have a service-connected disability rating of 10% or higher, you won't need to pay a copay for outpatient care. If you don't have a service-connected disability rating of 10% or higher, you may need to pay a copay for outpatient care for conditions not related to your military service at the rates listed below. 2024 outpatient care copay rates. So remember that if you're being seen for a service-connected condition, you don't pay anything. So this would be for other situations. So 2024 outpatient care copay rates, primary care services like a visit to your primary doctor, $15. Specialty care services like hearing specialist, eye doctor, surgeon, cardiologist, so forth, $50. Specialty tests like MRI or CT scan, $50. The notation, you won't need to pay any copays for x-rays, lab tests, or preventative tests and services like health screenings or immunizations. Inpatient care copay rates, care that requires you to stay 1 or more days at the actual hospital. If you have a service-connected disability rating of 10% or higher, you won't need to pay copay for inpatient care. If you're in priority groups 7 or 8, you'll pay either our full copay rate or reduced copay rate if you live in a high-cost area. You may qualify for a reduced inpatient copay rate no matter what priority group you're in. To find out if you qualify for a reduced inpatient care rate, you can contact the VA at 877-222 877. Again, 877-222-8387. And, look, this stuff is all kind of quirky. You might not know what priority group you're in. I'm just awareness, right? Then you should contact the VA at that number so that way you can ask them, hey, where do I fall in this if you have any questions. Moving on, 2024, reduced inpatient care copay rate for priority group 7. First 90 days of care during a 365-day period, $326.40 copay plus $2 charge per day. Each additional 90 days of care during the 365-day period is $163.20 copay plus $2 charge per day. Another notation, you may be in priority group 7 and qualify for these rates if you don't meet eligibility requirements for priority group 1 through 6, but you have a gross household income below our income limits for where you live and you agree to pay copays. 2024 full inpatient care copay rates for priority group 8. First 90 days of care during the 365-day period, $1,632 copay plus a $10 per day charge. This is why it's important to get into the lower number priority groups. Okay, this is priority group 8. You want to get up to, the top 6 would be good. So priority group 8 pays for the first 90 days of care in a 365-day period is $1,632 copay plus a $10 per day charge. Each additional 90 days of care during the 365-day period is $816 copay plus $10 charge per day. Another notation, you may be in priority group 8 and qualify for these rates if you don't meet eligibility requirements for priority groups 1 through 6 and you have a gross income above our income limits for where you live. Agree to copays and meet other specific enrollment and service connected eligibility criteria. Medication copay rates. If you're in group 1, you won't pay a copay for any medications. There's a notation, you may be in priority group 1 if we've rated your service connected disability at 50% or more disabling. 50% is the threshold. It's what gets you into group 1. You get faster appointments, better treatment. Not better. It should be the same treatment. Better treatment with regard to getting into your appointment, right? So you get fast tracked. You get somebody from group 8 calling in to make an appointment and somebody from group 1 calling in for an appointment. Group 1's going to get that appointment faster than group 8. So 50% or more disabling. If we determined that you can't work because of your service-connected disability called unemployable, or if you've received the Medal of Honor. So those are the 3 kind of situations into priority group 1. If you're in priority groups 2 through 8, you must pay a copay for these types of medications. Medications your healthcare provider prescribes to treat non-service connected conditions and over-the-counter medicines like aspirin, cough syrup, and vitamins that you get from your pharmacy, from your VA pharmacy. You may want to consider buying your over-the-counter medications on your own. The costs for any medications you receive while staying in a VA or other approved hospital or health facility are covered by your inpatient care copay. The amount you pay for these medications will depend on the tier of the medication and the amount of medication you're getting, which we determine by days of supply. Once you've been charged $700 in medication copays within a calendar year, January 1st through December 31st, you won't have to pay any more that year, even if you're still getting more medications. That's called the copay cap. So your medication copay cap, if you're in priority groups 2 through 8, is $700 per year. So that's the most that you would pay. Outpatient medication copay amounts, tier 0, $0. Tier 1 goes up to $15 for a 61 to 90 day supply. We'll do the 1 through 30 day, up to a 30-day supply. Tier 1, $5. Tier 2, $8 for a 30-day supply. Tier 3, $11 for a 30-day supply. If you have a service-connected rating of 40% or less, and your income falls at or below the national income limits for receiving free medications, you may want to provide your income information to the VA to determine if you qualify for free medication. So there's also some additional information for geriatric and extended care copays. We'll jump into that. So for geriatric and extended care copays, inpatient care up to $97 copay amount for each day of care. $97 inpatient, outpatient care $15, domiciliary care for homeless veterans $5, and that will go ahead and conclude it. Just wanted to, again, bring it to your awareness that there are charges for some veterans and there are not charges for others. It's important for you to understand and not be shocked if you end up getting charged. Nobody's ever shocked if it's zero, or they are, but they're just happy about it and move on. You're shocked when you get a bill in the mail. So you want to make sure where you fall, what priority groups you're in, that type of stuff. Call the VA, ask them if you're not sure. Thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.